Now we go now to the Trypanosoma, the Trypanosoma species, starting first with the Trypanosoma Brussei complex. So it's a complex because it's composed of two species then. Alright. So it was first discovered by David Bruce, hence Brussei, diba? Or Brussei. So based in honor of Sir David Bruce, alright? And it causes again the trypanosomal disease Nagana, which is found in cattle, no? And the sleeping sickness. Ayan, sleeping sickness. Also, it causes your African Trypanosomiasis or Trypanosomiasis. Alright. And it's a complex because it contains three subspecies. You have the Trypanosoma Brussei rhodesiense, which causes the East African sleeping sickness, or the Rhodesian Trypanosomiasis, which is a more rapid and more fatal form of sleeping sickness. And you have the Trypanosoma Brussei gambiense, which causes the West African sleeping sickness, and the Trypanosoma Brussei, diba? Brussei, ayan, which primarily affects wild and domestic animals, so dili sa humans. So we have the main species that infect humans. You have the Trypanosoma Brussei gambiense and rhodesiense. Now, how do I remember? Diba, rhodesiense. If you pronounce it, is parang medyo mas maraming letter E, diba? Rhodesiense. So, imo yung mouth kay diba? So, dagan siyang E, so siya ang makakos sa east. O, diba? Ayan. So, siya ang makakos sa east, dagan siyang E. Aside from that, siya ang mas severe. So, dagan siya pong letter E, ayan, severe, so, siya ang makakos sa east. Okay? So, katong daghang letter E, siya ang makakos sa East African sleeping sickness. Okay? So, rhodesiense, di ba? Kaysa compared sa gambiense, di ba? Imuhang pag-pronounce kay medyo murag, dili siya ano. Basta pinakadaghang E is rhodesiense. Okay? Rhodesiense, severe, daghang letter E, no? Siya ang makakos sa East African sleeping sickness. Ayan. I don't like letter E. Charot! Joke lang. Okay, jama. Chakara. Okay. Now, again, same with Leishmania. It's a vector-borne disease. This time, lahi ang imo vector. It's now your tsetse fly. Okay, so ang pag-pronounce niya kay depende sa kung asa kagikan. So, daghan siyang pwedeng pronunciations. Pwede siyang tsetse fly. Pwede siyang tsetse, no? Tsetse fly. Pwede po siyang tsetse, no? Tsetse. I'm like tsetse. Twice, yes. I'm like tsetse. Joke. Okay, so tsetse, or tsetse fly. Okay, tsetse fly. Ganun. Okay, so, but for me, mas comfortable kog tsetse, no? Tsetse fly. Ayan. So, tsetse fly or your Glossina spp, no? Glossina spp, Glossina species, Glossina morsitans for gambiense, and Glossina palpalis, the ideas, please change kay marg palpatis akong nabutang. So palpalis, T. Brussei rhodesiense. Basta Glossina species. Alright. So vector again is the tsetse, no? Tsetse, don't forget lang twice. Okay. Tsetse fly, tsetse fly, tsetse fly. Okay, alright. Ayan. Okay, and here's an example of your tsetse fly. So, depende siya sa area, no, na iuban sa Africa, tsetse, depende po siya kung taga-asa ka, no? But for me, tsetse fly akong pag-pronounce. Okay? Alright, ayan. Now, we go now to the mode of transmission. Again, it's primarily to the bite, no, of infected vector, your tsetse fly, or other mechanical methods, such as blood-sucking insects, accidental needle prick, and vertical, mother to fetus. So, it can be transmitted blood-borne, no? So, it's highly infectious there. So, again, if you examine a sample that is suspected of having the sleeping sickness, then you have to be extra cautious. Okay? Alright, ayan. So, follow Japon, standard precautions. So, life cycle, of course, what we get, no, or the infective stage now is the trypomastigotes, okay? The trypomastigotes, ang infective stage niya, which again, mo sulod sa atawang body or sa humans. Ayan, the metacyclic trypomastigotes, and the diagnostic stage is trypomastigotes. Okay, alright. Now, it lives in the blood, lymph nodes, and spleen, and also CSF. Alright. Highly pleomorphic, meaning pwede siya mo assume, no? Ayan. Mahilig tayo sa mga assume na yan, charot. So, hilig siya mo assume, or it can assume a lot of shapes, okay? And can have a variety of forms in the blood smear. And sa blood smear pod, if kanang fresh sample, you can see na motile gyud siya. Paspas siya mulihok, no? With its undulating membrane. Diba na siya undulating membrane? Same with trichomonas. Diba itong mnemonics? 2T, no? Trichomonas and trypanosoma. Ang undulating membrane. Okay, alright. Ayan. Now, we go now to the life cycle of your African Trypanosomiasis. Again, the infective stage of this organism or of this parasite to humans is the Trypanosomiasis. Now, again, when the tsetse fly takes a blood meal, nipaak siya sa usa ka patient or sa ka host, yang inject, no, ang Trypanosomiasis. Okay, let's say that the tsetse fly is again infective, na siya Trypanosomiasis. So, pag inject sa patient sa Trypanosomiasis, the Trypanosomiasis again, they become or they reside in the bloodstream and then they divide dito. Okay? Now, the circulating Trypanosomiasis nag-circulate na sa bloodstream sa mong patient. Now, when another tsetse fly takes a bite, no, of the infected patient, so the Trypanosomiasis are injected back, no, to the tsetse fly, and inside the tsetse fly, the Trypanosomiasis become procyclic Trypanosomiasis and then a hemong epimastigotes, all right? And then finally the metacyclic Trypanosomiasis, or when you say metacyclic, it's now the infective Trypanosomiasis. Okay? So in a way, very simple din naman, no? The Trypanosomiasis and epimastigotes ra ang morphological stages na gi-follow sa Trypanosoma Brussei. Okay? So Trypanosomiasis lang and epimastigotes. Okay? But infective stage is the metacyclic Trypanosomiasis. So again, when you say metacyclic, infective Trypanosomiasis. Okay, ayan. So again, cattle or possibly mga wild animals are mga reservoir sa imuhang T. Brussei rhodesiense. Again, East African rhodesiense, severe, daghang letter E. Okay, ayan. Alright, ayan. That's for the African Trypanosomiasis. Okay, now we go now to the disease. Again, your African Trypanosomiasis. Now, African Trypanosomiasis caused by the West African species or T. Brussei gambiense, it's considered to be the more milder, longer, chronic form of sleeping sickness. And it usually ends fatally with CNS involvement, pero after pila pa ka years, no? Several years. Compared to your T. Brussei rhodesiense, the East, this is what we consider the more severe and more fatal. More rapid ang progression sa disease. And it can end fatally within a year lang. So, ina na siya kapaspas. Okay? Alright, ayan. So, mas paspas pa kayo sa pag-move on sa imong ex. Charot. Okay, ayan. So, again, East African ang mas fatal and mas rapid ang disease progression. Okay. Now, initial lesion, of course, diba, bite man na siya because nipaak man ang tsetse fly. It begins as an erythematous chancre, okay? Progressing into a central eschar. Nako, ayan, eschar. Nako, bakte, eschar. Kinsa nga nitong makakause og black eschar, no? Black eschar, and also produces the most potent neurotoxin, which is your, what's that? Anthrax na raw, klaro na kayo. The anthrax toxin, Presobuzzer C, Bacillus anthracis. Basta central eschar, black eschar, no, black eschar, you have Bacillus anthracis. Nako, black eschar, nako talaga, please take note of that. Recall inyong bakte, B. anthracis. Okay? O bioterrorism agent, diba? B. anthracis. Okay. Okay. Alright. Produces a toxin again, your anthrax toxin. Okay, alright. Ayan, sige. Again, black eschar is your Bacillus anthracis. Now, for Trypanosomiasis african, it can cause or it can begin as again an erythematous chancre and then progresses to a central eschar. So, medyo mas mudako siya and mas mulalum ang samad. Okay. Now, chancre more common in the Gambian or the West, no, African sleeping sickness. Now, both types undergo two stages. First is the hemolymphatic. So, sa blood, no? Blood ang involved. And lastly, the meningoencephalitic. So, na-involved na sa CNS. Okay. Alright. Now, for early hemolymphatic stage, again, by the name itself, early hemolymphatic. So, ang involved is the bloodstream and the lymphatic system. So, parasites are prevalent or daghan makitaan sa bloodstream and lymphatics. Symptoms include fever, headache, joint and muscle pain, malaise, no? And you could also have anemia, myocardial infarction, myocardial inflammation, DIC or disseminated intravascular coagulation, and renal insufficiency. So, again, affecting the blood and the lymphatic system. All right, and we have this characteristic sign known as the winter bottom sign. Winter bottom sign is the swelling of the lymph nodes. Okay, especially those that can be seen at the likod sa neck, diri. So, winter bottom. So, that's how I remember. Bottom sa neck. Ayan. Nako, mga bottom dyan. Winter bottom sign. Okay. Here is an example. Ayan. So, nice swelling, no? Mas klaro ni siya sa inyong sa handout na guy. Okay, I'll send it once mahuman. Again, this swelling sa lymph nodes, there is a neck dapit. Okay, my neck, my back ulit. Ayan, so winter bottom sign. Early hemolymphatic, no? Lymphatic, by the name itself, hemo, sa bloodstream and lymphatic system ang affected. Now, usually, ang T. Brussei rhodesiense, or the East African T. Brussei, di ba? Has more, no, parasitemia sa blood compared sa Gambiense. So, ang rhodesiense, mas daghan siya sa blood kaysa sa Gambiense. Okay? Mas daghan siya sa blood also kaysa sa ubang mga tissues. That's why it's best to recover it sa blood. Okay? So, mas daghan siya sa blood compared sa imuhang T. Brussei Gambiense. Okay? Alright, ayan. So, that's for your African Trypanosomiasis. And also, lymphadenopathy, again, involved ang lymphadenopathy. It's a consistent feature in Gambian Trypanosomiasis. But for Rhodesian Trypanosomiasis, dili kayo common ang lymphadenopathy. Okay? So, sa Gambian siya mas common. Okay. Now, the second stage is, of course, the meningoencephalitic stage. By the name itself, meningoencephalitic involved na ang brain and meninges. So, if magpadayon ang infection, makaswim na, no, or maabot na sa mga trypomastigotes ang brain and meninges. And once it goes there, it causes now neurologic symptoms like mga apathy, behavioral changes, headaches, sleep pattern changes. Severe symptoms, mga convulsions, problems sa mga speech, no? You have tremors, and etc. And it can also lead to Kerandel sign, no? Kerandel sign, which is a delayed sensation to pain. No? Sana all, I hope na ako yung na tsada nang nakakainana, no? Like, kanang ability lang ba na dili ka madutlan na yun o sakit? Pa! Or di dahil ka masakitan? Yeah. Oh my gosh, I need, charot. Delayed sensation to pain. Kerandel sign. And later stages pag yun is somnolence, no? Excessive drowsiness, excessive sleepiness, kana sige kang giduka. Oh my gosh, is that me? Charot, sige giduka. You know, sleep is life. I love sleep, di ba? So, yes. Can I get an amen? Charot. Ayan. So, excessive sleepiness, excessive drowsiness, somnolence, and then followed by a deep coma. So, muna siya. Sleeping sickness, and then eventually death. Sleeping sickness because it's one of, di ba, the symptoms or presentations is somnolence, no? Excessive sleepiness, masikag duka. Okay? Alright. Because again, the trypomastigotes have reached the brain na and it's causing destruction there. Okay? Alright, so that's the end stage of your African Trypanosomiasis, and eventually it leads to death. Okay? That's why it's important to diagnose it as early para treatment will start early, especially with the East African, your T. Brussei rhodesiense, because the disease progression is very fast, no? It's very rapid. So, mas daling mamatay ang patient sa imong East African sleeping sickness. Okay, alright, ayan. Now, we go na to diagnosis. Of course, still the same demonstration of trypomastigotes in the specimen. Okay? Blood, you know, chancre aspirate, lymph node aspirates, sternum, bone marrow, and also CSF. Okay. Now, here are example of your trypomastigotes. You have, as you can see, T. Brussei, no? T. Brussei. Sorry. You have T. Brussei. Ayan. You can see the undulating membrane, right? And you have here a small kinetoplast, okay? Take note of that. Small kinetoplast ang T. Brussei. We'll use that later when we compare T. Brussei with T. Cruzi. Okay. Now, GEMSA-stained thick and thin blood films, of course, diba? As we have mentioned already in the blood specimen. We can detect parasites if at approximately 1 parasite per 200 HPFs, no? Muna detection limit. For thick films, detected when the numbers are greater than 2,000 per ml. Alright. And of course, capillary tube method, QBC, Buffy coat then. We can detect it when the parasites are greater than 100 per ml of the sample. Okay? So again, definitive talaga is demonstration of the trypomastigotes. Now take note again, the trypomastigotes ang makitaan sa peripheral blood. And in the peripheral blood, the trypomastigotes divide in the peripheral blood. Okay? For T. Brussei complex. Okay? Alright. Now, for T. Brussei rhodesiense and Gambiense, you cannot distinguish it based on morphology alone. So, if you want to distinguish if Gambiense ba na siya or rhodesiense, you look at patient's history. No, kung asa ba siya gikan. Is the patient gikan from West Africa or East Africa or inana? Because main differentiation is from the area. No, that's why we have the West African and East African sleeping sickness because depende siya kung asa gikan ang imuhang patient. So if you want to determine if it's Brussei rhodesiense or Brussei Gambiense, you look at patient's history, okay, and other mga information sa patient, okay? Because if morphology sa trypomastigote alone, you cannot differentiate the two, okay, because they look the same. All right? Ayan. Okay. Now, another method is, of course, CSF examination. In cases of late stage na and stage sleeping sickness, the presence of your MOT cells is pathognomonic for trypanosomiasis. So, when you say pathognomonic, it's really pointing to that disease, no? So, example, kanin siya, MOT cells. So, makita niyo mo siya sa CSF, press the buzzer, African Trypanosomiasis, yun na siya. So, MOT cells, pathognomonic. It really points to the disease or it's really specific to the disease, okay? So, MOT cells, di ba, are plasma cells, varicose, hema, yes. MOT cells, plasma cells that has mga proteinaceous droplets sa iyang cytoplasm, okay? Ayan, MOT cells or your morula cells, di ba? So, ano yung mga droplets sa imong cytoplasm, may mga hole, ay mga dots. Okay? Alright. And there's also the presence of IgM in serum or CSF is considered diagnostic. Because in African Trypanosomiasis, IgM is increased, marked increased because of the continuous antigenic variation of the Trypanosoma Brussei complex na trypomastigote. So, magsigig change ang antigenic surface sa imuhang trypomastigotes, your immune system also continues to produce antibodies specific to each changes in the antigenic surface sa imuhang trypomastigote. So meaning magsigig produce og IgM, di ba? Okay, from time to time magsigig change ang antigenic surface sa imuhang trypomastigotes. Hence, di ba, padayon pod og produce sa imuhang body og IgM specific to the new changes in the antigenic surface sa trypomastigote. So, there is continuous increase of IgM. So, the presence of IgM, even IgM in serum or CSF, is considered diagnostic, okay, for African Trypanosomiasis. Okay, antigen detection, we use ELISA or the CIATT, CARD, indirect agglutination test. So, it's an agglutination test using CARD, no? Ayan. So, indirect agglutination test. Here's an example of your cat. Kaning cat, the idea is for antibody detection, okay? Card agglutination. Pero kung CIATT, antigen. Okay, so, antibody detection, if ever the patient is immunocompetent, no, the immune system is working well, if walay IgM na nakita or walay elevated IgM levels na nakita, then that patient is ruled out or the patient is not suspected of having African Trypanosomiasis. Okay? Because again, di ba, characteristic yun sa serum of the patient having African Trypanosomiasis is increased IgM. Because again, of the antigenic surface variation, palaging nag-change ang antigen surface sa imuhang trypomastigote, which leads your immune system to continuously produce IgM that is specific to the new antigens na nakitaan sa surface sa imong trypomastigotes. Hence, there is an increase always of IgM. Okay? And again, if wala na siya nakita sa patient, immunocompetent ra siya, meaning okay ra yung immune system, if absent ang elevated IgM levels, then that patient doesn't have, no, or the patient is ruled out for African Trypanosomiasis. Okay, alright, ayan. Okay. Alright, so that's all for your Trypanosoma Brussei complex. Okay, alright, so we'll now proceed to the next Trypanosoma species, and that is your Trypanosoma Cruzi or Cruzi. Now, there are a lot of other Trypanosoma species deers, like Trypanosoma evansi, yes, na Trypanosoma lewisi, no, Trypanosoma, etc. But usually these other species of Trypanosoma affect na animals, okay, not the humans, all right? So the main species of Trypanosoma that affects man are your Trypanosoma Brussei complex, Trypanosoma Cruzi, and Trypanosoma wrangelii, all right? So we proceed to the second, which is Trypanosoma Cruzi, and Trypanosoma Cruzi causes your American Trypanosomiasis. So opposite sa mong African, it causes American Trypanosomiasis, or also known as your Chagas disease. So because it was discovered by a young medical student named Carlos Chagas in Brazil. So sana all, di ba? Naka-discover og bagong parasite and the disease was named after him, di ba? So deserve din naman ni Kuya, no, ni Ayuk Kennings, no? Deserve ni Ayuk ni Kuya ang being named after him, di ba? So after studying the parasite, no, he discovered, so Chagas or Chagas disease. So American Trypanosomiasis, because this type of Trypanosoma can be found in the Americas, usually mga South America, like Brazil, no, and Central America din. Okay, ayan. So the vector now is different. So again, ang Trypanosoma brucei is the tsetse fly. So, how do I remember, di ba, si Bruce Lee, kay murag, tig martial arts mo na siya, so, murag, Setsi, pangit, basta. So, di ba, parang Setsi is parang pang-away, in a way, di ba? So, Bruce Lee. You can find your own mnemonics, saka mo na bahala. But for Trypanosoma Cruzi is the triatoma bug, or the kissing bug, your reduviid bugs, your assassin bugs, and cone nose bugs. So, kissing bug daw kay, pagpaak niya nimo, it feels like you are kissing. It feels like someone is kissing you. Sana also, I need this. Para at least naman, maka-feel ko nag-kiss after pila ka year. Chara joke, drama eyo. Ako mga cravings. Cravings? Okay, alright. Ayan, so triatoma, again, your kissing bugs, reduviid, assassin, or your cone nose bugs. So, muna siya, no? Your triatoma SPP. Okay, ayan. Now, the mode of transmission is not bite. Okay, dili siya like parehas sa imuhang sandfly and tsetse na ang insect good ang mupaak, and then pagpaak niya iyang inject ang parasite. No, ang kay triatoma or kay Trypanosoma Cruzi, bastos ang bug, no? So after niyang paakon ka, malibang siya nimo. Malibang siya sa imuhang skin. Okay, now because the bite is itchy, so what happens is imo scratch ang area. So pag scratch nimo, you're introducing the feces of the triatoma bug that now contains the infective form of the parasite. You're introducing the infective form of the parasite to the wound, no? So contamination of the bite wound with the feces from the triatoma bug. So, inana siya kabastos to ni paak na ganit siya nimo, nalibang pagid siya nimo, di ba? So, ayan, because it's itchy, what you do is, di ba, you scratch. So, you're introducing the feces of the triatoma bug on your skin that contains the infective form of the parasite you're introducing it to the wound, bite wound, okay? And dito na siya na-infect. Okay, alright. Pwede po siya sa mucosal areas such as the eyes or sa mouth. And aside from that, pwede pong congenital infections, blood transfusions, or even organ transplantation if dili siya makitaan, okay? Or dili ma-screen ang blood properly. Alright, ayan. Now, your life cycle again, still the same with your T. Brussei. Your metacyclic trypomastigotes ang imuhang main mode of transmission. Okay, your main infective stage. Okay, ayan. And the diagnostic stage lang, again, as mentioned, we can also see amastigotes aside from trypomastigotes in your tissues, no? So it's not only trypomastigotes but also amastigotes. But for T. Brussei complex, trypomastigotes siya ginatong makita sa sample or sa human samples. For T. Cruzi, pwedeng amastigotes and trypomastigotes. Okay, alright. Alright, so we now proceed to the life cycle of your Trypanosoma Cruzi. So again, no? Triatomine bug, malibang siya, okay? Kaluto nimo ang bite wound, so ma-infect. So masulod siya sa imuhang mucosal surface, sa imuhang skin. Now, the trypomastigotes, again, once inside, they now transform into amastigotes. So ang amastigotes, reside sila again within the infected tissues. And again, after maturing, lyse the cells, no? And then they transfer again into trypomastigotes, no? So within the cells of your kung asang amastigotes, mo transforms like trypomastigotes and then mo gawas sa imuhang cell and then into the bloodstream. Okay. Now, your trypomastigotes can infect other cells and once again inside the cells, mo transform siya into amastigotes. Okay, so amastigotes inside the cells, dahil kung ready na, mahimong trypomastigotes, burst the cells and then ato sa bloodstream, mangitag laing areas or laing cells, and then infect na po the cells, become amastigotes inside the cells. Okay? Now, the circulating trypomastigotes, once again another triatoma bug, again takes a meal, makuha na niya ang trypomastigotes from the host, okay? Now, inside the triatoma bug, the trypomastigotes become epimastigotes, okay? And then, nag-multiply sila sa midgut, and then, balik na pug metacyclic trypomastigotes. So, in a way, inanayahang life cycle, no? So, ang makuha Japon sa imuhang triatoma bug is the trypomastigotes, okay? Alright? Or pwede po ng intracellular amastigotes from the cells sa imuhang blood or sa asa magani, and then pag kaon niya sa triatoma bug, no, the trypomastigotes again will be converted to epimastigotes. Okay, so nibalik siya, no, epimastigotes muna, and then procyclic trypomastigotes, meaning dili pa infective, and then the metacyclic or the infective trypomastigotes na. So they will now go to the salivary glands, no, of your triatoma bug, and then the cycle goes on. Okay? So, as you can see, again, the 4 stages, no? Apet, amastigotes, pro, epi, and trypo can be seen in the T. Cruzi na stage. So, ang pro-mastigote, mahitabo siya sa triatoma bug yapon. So wala siya gi-mention here, no, pero it undergoes japon. Part siya sa life cycle ang promastigote diri sa vector sa T. cruzi. Okay? Alright. Basta ang 4 stages ma-exhibit sa T. cruzi. Okay? Or T. cruzi. Alright. Ayan. Now, we go now to your disease. Ayan. So, your disease, again, is your American Trypanosomiasis or also known as your Chagas disease. Now, again, it can be divided into 2 phases. Pareha sa imuhang T. Brussei or African Trypanosomiasis. But this time, it's acute and chronic. So, for acute phase, it starts first with the bites, di ba? The bite, no? Or pagsulod sa imong trypanosomiasis, ang iyahang main organ na gina-affect is the heart, okay? So, main inflammations sa imong heart, no? Myocardium, non-specific symptoms, fever, malaise, no? Nausea, lymphadenopathy, trachoma, which is again the result of the bite sa imuhang triatoma bug. And then also, if sa eyes siya dapit, no, or sa mouth, especially sa eyes, it can cause what we call your Romania or Romania sign, which is maghubag or na-edema sa imong eyelids. Ayan. Alright. And sa face. Okay. And if mapadayon, acute myocarditis, of course, sa heart, and hepatosplenomegaly, edema of the face, legs, and feet could happen. CNS involvement can be present, pero if appeal ng CNS, very poor ang prognosis. So, when you say very poor prognosis, then the patient would eventually die, no? Or bad ang iyahang pag-recover. Okay, ayan. Symptoms resolve after 1 to 2 months, and the patient goes into a latent or asymptomatic phase. And it's during this phase na walay ma-feel, di ba? Asymptomatic, sana all. Sure. Wala siyang ma-feel na symptoms, pero it can still transmit the trypomastigotes to others, okay? Or to another triatoma bug. Okay, ayan. So, that's for the acute phase. Now, we go now to the chronic phase. Joke, before that is the pictures there. You have the Romania sign. Ayan, so nang hubag, no? Ang mata, okay? Na edema sa eyelids, okay? And then the trachoma, kaning reddish area. Again, muna siya kung asa ni paaktong triatoma bug. Okay, now ang Romania sign, again, it's not specific po na appearance. Kay naka-experience ako ginana po, di ba? Kanang mapaakan kag cockroach or something, no? So, or mga allergic reactions na po inana, no? So, it's not specific. So, if usually makakita kag Romania sign or inana, then you also have to look at other information like history of the patient, no? Kung aso siya gikan, ganun. Alright? Ayan. Sige. Now, we go now to the second stage, which is your chronic phase. For chronic phase, again, the primary organ affected good sa imuhang trypomastigotes or your organs, ang primary organ affected by your organism is the heart, okay? So, amastigotes, di ba? Amastigotes of Trypanosoma Cruzi, dito mo sulod or dito mo live sa heart. Okay? So, yung i-damage ang heart and it can lead to mega syndrome. So, aside sa heart, pwede po siyang makakos og mega colon, mega esophagus, no? Mag-enlarge ang colon and esophagus, example kani, because madamage ang mga nerves dapit dito and mawala ang muscle tonicity, no? Or mawala ang pagka-rigid sa muscles. So, what happens is maloosen na siya. So, pwede na siyang mo-enlarge. Okay? Ayan. So, mega colon, mega esophagus. And the most frequent clinical sign of Chagas disease na chronic is cardiomyopathy. Again, naguba na yung cells sa heart. It leads to cardiomegaly and differences in conduction changes sa electrical impulses imong heart, sa beating sa heart. Okay? And selenium is considered to be a biological marker for Chagas disease, because if deficient kag selenium, you're more prone to mga cardiac diseases caused by your Trypanosoma Cruzi, okay, in the Chagas disease. So selenium, ayan. So again, primary organ affected is heart. So again, what you have to remember lang, ganun siya mga DACs, no? Or it can cause mga DACs, mega colon, mega esophagus, and you have cardiomegaly. So mga mega, gusto niya ng mega. So si Trypanosoma Cruzi, di ba, si Sharon Cuneta, si Megastar. So ganan siya mega, Cruzi. Okay. How do I remember? Wala mo ko yung mnemonics sana. Basta ako lang i-take note is basta Trypanosoma Cruzi, ganan siya o mega, ganan siya dako. So kinsa mo pwede ganahan. Charot. So ganan siya or makakause yung mga DACs, no? So mega colon, mega esophagus, and you have cardiomegaly. Especially cardiomegaly yun, ang pinaka-important na sign niya. Okay? Alright, ayan. Now, for diagnosis, again, same with T. Brussei, the demonstration of the trypomastigotes and the samples collected, and even mga positive serologic reactions, and also amastigotes in tissues. Aside from that, thick and thin blood films. Characteristic shape of your trypomastigote is C or U shape, no? C or U. Possible na po S shape, alright? Pero seldom rang S shape. And very important, prominent kinetoplast. Dako iyang kinetoplast, okay? Which is characteristic of Trypanosoma Cruzi. Okay. So, stain of choice is GEMSA. Ayan. So, here is an example. Kani kay S-shape siya, di ba? Pero very important kani siya, dears. This is the kinetoplast. Okay? Na dako. So, dax siya kinetoplast. Prominent. So, yung makakita kag prominent kinetoplast, then, again, that is Trypanosoma Cruzi. Okay, alright. Next, you have concentration procedures such as the Strout method. Kani siya na method, ako siyang gitry og find, no? Sa yung procedure, pero wala ko ka-find. So, specific siya for Trypanosoma Cruzi, Strout method, a concentration procedure gyapon. Okay, alright. Now, next, you have culture. Of course, media of choice pa rin is the NNN. We can examine epimastigotes. Epimastigotes ang ma-produce for up to 30 days. Okay, so NNN, again, composition of NNN, defibrinated rabbit blood agar. Okay, please take notes. Okay, now Xenodiagnosis, again, something that is also unique or commonly, or that can be performed in your T. Cruzi. We use animals, no, as test systems. No? So, ato i-test ang animals. This time, si Tryatoma. So, what we do is, in endemic regions, especially sa mga endemic areas na daghang Tryatoma bugs, we get a Tryatoma bug na uninfected. We let it feed on a patient that is suspected of having Chagas disease, okay? And after pila ka days, we examine the stool of your Tryatoma bug to look for trypomastigotes, okay? And if positive ang Tryatoma bug for trypomastigotes, then the patient is expected to have Chagas disease. Ayan, alright. So, we examine the stool samples of your Tryatoma bug after letting it feed, no? After nimo siyang ipakaon sa blood sa patient suspected of having Chagas disease. Okay, that's Xenodiagnosis. You use the test animal, no, which is Tryatoma bug. Okay, alright. Ayan. Serologic test, you have the complement fixation test, also known as the Guerreiro-Machado test, IFA, indirect hemagglutination test, and ELISA. Now, recommended test for confirmatory na serological diagnosis is your Western blot. Okay, so same siya with, kinsa man ang confirmatory ang Western blot, your HIV. Nako, IS pa rin. Okay, Western blot. And complement fixation, di ba? Recall, IS, unsa may positive result, ani? No hemolysis or hemolysis? Ang positive result is no hemolysis. Kaya di ba, it's an inhibition test. Ayan. Nako, IS talaga. Kamusta na natin dyan? Okay? Alright, so, those are the serological tests, no, for your Trypanosoma Cruzi. And lastly is PCR. Of course, it's useful for diagnostic of chronic Chagas disease because possibly sa chronic Chagas disease, wala na kayo trypomastigotes na makita, no? Or di na kayo daghan na makita sa peripheral blood, so sometimes hindi na siya makita. So it's best to detect it through molecular assays para yun ma-detect ang genetic material sa imong parasite in the blood. Okay, alright. So that's for Trypanosoma Cruzi. Very important lang is C, U-shaped trypomastigote, mega, okay, mega colon, mega esophagus, cardiomegaly, ayan. So mga ducts na mga diseases. Okay, alright. And the last species, of course, is your Trypanosoma wrangeli. It's non-pathogenic, but it can coexist, no? Or it can be recovered at the same time with T. Cruzi. Ayan, that's why we need to differentiate the two. Now, as you can see, ang iyahang trypomastigote is slender. Mas niwang siya compared sa imuhang Trypanosoma Cruzi. Okay, so it's slender and smaller iyahang kinetoplast. This one. Kani mga dot dira. That's smaller kinetoplast. Okay, so that's the difference between T. Cruzi and T. wrangeli. Okay? Because again, they can be recovered at the same time. Alright? So, ang iyahang Tryatomin bug is Rodnius prolixus. Okay? So, that's iyahang vector. Okay? But again, difference nila sa T. Cruzi. The T. Cruzi again is much more wider. It's wider. Slender ang imuhang T. wrangeli. And the kinetoplast, very important, smaller sa T. wrangeli. Okay. Alright. Now, again, to differentiate, itong last part, to differentiate T. Brussei and T. Cruzi. Again, remember the size. Your T. Brussei is larger. It's actually 2 times larger than your RBC, an red blood cell. And ang Trypanosoma Cruzi nimo is smaller, about the size of an RBC. Very important thing to note is the kinetoplast. As mentioned, T. Brussei na trypomastigote gamay, ilahang kinetoplast, yamags, jutes, okay? For T. Cruzi, larger, prominent kinetoplast. And for reproduction, your T. Brussei reproduces as trypomastigotes in peripheral blood, but for Trypanosoma Cruzi, divide as amastigotes in tissue but never in blood. Okay? So T. Brussei complex, mo divide sila as trypomastigotes in the blood. For T. cruzi, ang mastigotes in tissues, ang ilahang mode of division. Okay? But very, very important, very distinct yun is the kinetoplast. Kung large kinetoplast na ganina, then press the buzzer kay T. cruzi. But if it's smaller, no, if it's smaller, then possibly kay T. Brussei or kay T. Wrangeli. Okay, ayan. Now, here is the picture. Yan, from Twitter. Yan, si @RichDavis. May kanya siya. If you want to follow him, you can learn a lot through this. He's a great Twitterist. Twitterist. He's a great account to follow. So for T. Brussei, as you can see, diba, it's much larger than the RBC. But the kinetoplast, kani siya, nag-encircle is smaller. Compared to your T. cruzi, again, larger kinetoplast, okay? And as you can see, about the size of an RBC lang, okay? And it's much more slender, no, compared to your T. Brussei, okay? Ayan. And the T. Wrangeli, again, is slender than your T. cruzi, and the kinetoplast is smaller, okay? So please take note, all right? And the mode of divisions nila and all that, okay? So that's the difference, or how you differentiate the T. Brussei complex and T. cruzi based on morphology. But again, no, aside from that, we can also look at, again, patient history. So kung asagi ka ng patient, endemic ba siya sa African or American Trypanosomiasis, that could already help you in differentiating or diagnosing kung unsa gid siya na Trypanosoma species. Okay? So kung gikan siya sa Central America, South America, then possibly T. cruzi. If gikan siya sa Africa, no? If you're from Africa, then why are you white? Charot. Diba? So, mean girls. So, if gikan siya sa Africa, then possibly that's T. Brussei complex. Okay? So, based on history palang daan, we can already identify. But if sa morphology, ayan. Again, small kinetoplast, T. Brussei complex. Large kinetoplast, T. cruzi. Press the buzzer. Okay. And that's the end, yes, of our pre-recorded lecture and also our lecture in the flagellates. Alright? So, before I forget, dears, I forgot to mention Giardia and T. vaginalis, Giardia lamblia. These two are known to possess, no, or to carry mga RNA viruses according to Zybig, okay? Wala gi-mention kung unsa na mga RNA viruses, but they are known daw to harbor RNA viruses, okay? Giardia lamblia, T. vaginalis. So, I forgot to mention during the first part, diba? So, please take note. Okay, alright. So, that's the end of our flagellates na lecture for this didactics na part. I hope na radyo mo na-learn. And pre-recorded lang ta kay para mas daghan tang nasulat. Again, I hope nakasabot ra mo, dears. If you have any questions, again, PM me. Alright? And I'll see you in our next pre-recorded. I'll see you in our next topic sa didactics, okay? And we'll continue with the protozoa until mahumanta sa para, okay? So, keep safe, dears. Salamat for watching. Thank you and have a great day. God bless.